Hello, good afternoon. I just want to get on here and discuss some things about my lighting wants to be in the way this morning. That's fine. We'll do it like that. Discuss some things about insulin resistance. I have some people coming on with me this evening, and I just want to talk about how, insulin resistance is and what it is about and what happens when it happens in your body, and just doing some wonderful things that have taught me about insulin resistance, that when you're fatigued and you're tired and you have no energy, the chronic belly fat, that inflammation, and the brain fog that you have, possible headaches, migraines, you're craving different foods, and all of those are things that people struggle with. You see skin tags, you see female balding around the hairline area, skinny fat, visceral fat. Males and females have that problem. So when you think about insulin resistance and you think about acne, all the things happen when insulin resistance is play. And what that does is it happens when the body doesn't respond to the insulin as it should. It increases the risk of type 2 diabetes. If you're diagnosed with insulin resistance, you can still take steps to prevent it, to actually delay it. And delaying the development of prediabetes and type 2 diabetes can be a game changer. So as we go out through here, I'm going to continue to look for her to see if I can find her on here. And continue just talking about insulin resistance and what it does. And lifestyle changes can help that and actually can make things better with you when you have lifestyle changes. So what is insulin resistance? It occurs when the body doesn't respond to insulin properly. The insulin is a hormone your pancreas makes that is essential for regulating blood sugar levels. And it also allows your cells to absorb and to use the glucose, which comes from the food that we eat. So when you think about that, we're eating constantly. We're making changes, we're adapting, but we need that energy balance to keep from preventing those glucose spikes. So, what happens sometimes is when we eat, it actually elevates our insulin, because insulin is a growth hormone. It does its job. It goes out there and it goes to the liver. It actually helps the liver. It goes to the muscles. It actually helps your brain. Insulin has a lot of different jobs. So if your cells can't absorb the glucose of the foods that you eat, hey Vossen, then the glucose levels continue to get higher. Okay, let me see. I think Miss Carolyn is coming in. See if that helped her. And actually, there she is. Hello.
Hi.
How are you?
I'm good. How are you today?
Doing amazing. Okay, so I have my wonderful, beautiful guest here, Miss Carolyn Berg. Miss Carolyn is a nurse of 42 years. But that's not the most important part of what she's a holistic coach. But that's still not the most important part. She is a breast cancer survivor. And let me tell you, when you have breast cancer, then you have traveled a road that is horrendous. But for 16 years, she has made a difference in her life. And now, being a holistic health coach, she's making a difference in everybody's life. So, Miss Carolyn, tell me where you from. Tell me a little bit about yourself. I am glad you're here.
Thank you, Mr. Long. Thank you for having me. I'm so excited because, like you said, it's been a challenge, but I am from South Carolina. I'm right across the river from Augusta, Georgia, where they have the Masters. So I'm about 10 minutes away from the Masters golf course. Yeah,
Wow.
yes, yes. But I am a 16-year breast cancer survivor, and I just thank God for allowing me to still be here because when I was told 16 years ago, that I only had a 20% chance of living after 5 years because I found my lump myself 5 months after a clean mammogram. And I'm like, what? And so that's why I tell women it's so important. And as we tomorrow starts, kicks off October, which is Breast Cancer Awareness Month. And I also founded a nonprofit in 2021 called Reduce Your Risk. And so, yeah, so, everybody talks about a cure, but what about prevention? And so I like being on that prevention side. And so I'm so glad to be here, to talk about, my journey, because I started that health journey 16 years ago. But I tell people all the time, don't wait until something breaks before you do something, because now I'm being reactive to those cancer diagnosis, but we need to be proactive with our health. And so I've been on that health journey ever since then. And I thank God that I am still here and able to talk to other people about their health journey because it's so, so important.
Definitely. And being a nurse and going through breast cancer and then going through other health issues, kind of, how did that make you feel? Because you've been a nurse for 42 years.
Yes. And actually, when I was diagnosed, like I worked in a space where it wasn't cancer. So all that was new to me. So I had to dig and learn all the things that I needed to know. And, it was so scary, very, very scary time for me, very fearful time for me. But, and then, I always say God has a sense of humor because when I was diagnosed, I was a hospice nurse. So I'm taking care of people who were dying from the same disease that I had. And so that was, and I knew that he had given me the strength to endure during that time. But it was very scary. And sometimes, we're close to the fire. So as nurses, we know too much, And
Yes.
so, when you have that diagnosis, the first thing you actually think of is you see your life just flashing before your eyes. You think death. You immediately think of death.
Yes.
And but yeah, but very challenging. But I'm just so glad to be on this side where I'm helping people holistically, and also helping them with the 4 pillars of health: nutrition, exercise, stress management, and sleep. Because that following those guidelines myself has allowed me to not just be a survivor, but a thriver.
I am so glad you brought that up. So, the 4 pillars of health, I want to talk about one in particular, and that's the nutrition side. What else were you struggling with besides the breast cancer?
Well, one of the things that happened, being on the medication, caused me to gain weight. It not only caused me to gain weight, but also caused issues with my joints. And so I was struggling, with a lot of those issues then. And and I was kind of, got myself, I thought, pretty straight until about 4 or 5 years ago when I'm finding myself again struggling with some of the same issues: the weight gain, the hair loss, the belly fat, not sleeping. All of this stuff was going on with me. And here I thought I was on a health journey, and I was eating the right foods. And come to find out that it was related to menopause, not knowing that the menopause is causing me to go into insulin resistance. Go figure. And
Yes.
the
Oh
and
my
the
goodness.
and
So,
go ahead.
no, no, go ahead.
And the crazy part, my hair started falling out. So I work as a holistic coach at a hair loss center, and my hair and the crown started coming out. So I had to become a client at the hair loss center. That was really devastating to me because I'm like, how can I help others when I can't seem to help myself?
Exactly. And that's one of the hardest road it is to be a coach when you're struggling as well. So you found yourself on the side of inflammation, hair loss, weight gain, all the signs of insulin resistance. And
Yes.
I'm gonna I'm gonna take a break right here. And guys, viewers, thank you guys for watching. Thank you guys for being involved. Tap the screen, share it. If you know somebody that's going or have been through breast cancer, is dealing with inflammation, weight gain, and hair loss, and menopause, because these are the cycles of what insulin resistance plays around. And when it starts to happen, these are the causes that you're looking for. And these are your body. This is what your body is saying. Hey, I want to talk to you just a little
Mhm.
bit. I need you to do something about this. So as Miss
Yes.
Carolyn go and talks about some of the first things she started noticing was the hair loss. How you said you had this after the fact that you had breast cancer, right?
Yes, yes, because my hair grew back. After the breast cancer, my hair grew back. I had a head full of hair. And then about 4 or 5 years ago, then I'm noticing my hair thin. And I'm actually, you know how the men do that comb over so you can't see the bald areas? Well, I was literally doing a comb over.
Wow.
You know, and that scared me because when I started seeing all this other stuff going in my body, being a cancer survivor, one of the things that we usually think about all the time when something going on in our body, we're thinking that the cancer has recurred. And
Hmm.
so in my mind, I'm thinking, okay, because once I got, had a biopsy done of my scalp, finding out that I had scar and alopecia, which is an autoimmune disease. So now I'm figuring out why is my body attacking itself. I've been on a health journey. And so that was very, very scary for me because I had not been in that position because all these years I had thought I was doing all the right things to keep my body healthy.
Oh, wow. So, you noticed that happening first. So, what steps did you take to do something about it?
Well, it was amazing because I tell people all the time, I always ask God when I got something going on, I was like, God, what is wrong with me? Because like I said, gain, when I started gaining the weight, because the weight gain could cause more inflammation, cause my immune system not to work properly, therefore increasing my risk of the cancer recurring. So I didn't want that. And I said, Lord, I don't want the cancer back. So what is going on with me? And then having the high cholesterol, not sleeping at night, and that's another stressor, and so I prayed and said, God, what is going on? And like I said, been a nurse for 42 years, but I had not heard about insulin resistance.
Mm.
And when I found out what was going on, actually I didn't know what was going on until a friend of mine, Beverly Grandison, I was being nosy when she quit this other company we was with. And I said, girl, what's going on? What you doing now? And she told me, and she said, I got something that is really helping a lot of people. I said, girl, send me the information. So she sent me a video, and right away I got it.
Yes.
And I realized the connection. And so I immediately, this was June of last year. And so I immediately got on the protocol. And OMG, the first week I lost 5 pounds. Like I've been trying to lose this weight for the past 2 years and nothing was budging. I mean, I'm going to the gym. I'm drinking a smoothie and a salad every day, like not eating because everything I eat was causing the scales to go up. So but it was miserable. Not having food freedom was miserable. And
Yes.
so that first week, I was like, OMG. And so, then I noticed that the belly fat was going away, the extra fluffs, and I'm noticing I'm sleeping better. And I'm like, it's something to this here. What is going on? Then I got my labs drawn, my cholesterol was normal. And then 90 days later, I realized I've lost 25 pounds and over 20 inches enjoying the foods that I never thought I would eat again. Eating, meats, eating real food, whole foods, and I was totally blown away.
So that's what I love about it because being a holistic coach, looking at things naturally, looking at a natural product, what God
Yes.
has made for us. I
Yes.
mean, it's right here in the palm of our hand.
Hmm.
And we just kind
Absolutely.
of set it to the side at times. And we don't realize what the foods that we eat are doing to our body because anything that's non contagious is reversible. And that's what
Yes.
I love about that. So I love your energy. So tell me a little bit about the energy process of this because I mean, you are banging.
So, like I said, I was a health coach right after I was diagnosed with the breast cancer, after I had changed, my prognosis had gotten better and I became a health coach then went on and became a holistic. But I just see so many people suffering. And, in my day, back in my early nursing days, people had acute illnesses. They
Mhm.
got better. They didn't have to take on a ton of medication, but now everything is chronic. And like we say, it's our food environment and the stress that when I say your husband's stressing you, your wife's stressing, your significant other stressing, your children stressing you, your job, stress is everywhere and causing us to have all these here issues. And so I was like, you know what? People need this. If I'm struggling and I've been on a health journey, and you just look around and you just can think about all the people that are struggling. And I was like, you
Yes.
know what? I can't keep my mouth closed. I have got to tell people because one of the things that is happening, 80% of the food that we eat today wasn't here 100 years ago. Everything is genetically modified or it's bioengineered, that means it's made in a lab. You know, when God created us, he put us in a garden, y'all, for a reason. He put us in
Yes.
a garden to eat real food,
Yes.
but we've left the garden. The garden has left us, you know, and it's not
Yeah.
always your fault. So I say you're not lazy, you're not crazy, because it's not, you know, it's unfortunate the world that we live in today. And so I was like, you know what, people need to know the truth, you know. And so I learned everything at that point in time. Everything I read books. You know, we have lots and lots of books. You know, I started reading them because I wanted to be able to educate everyone on really what's going on in your body. Why are you, as I call, stuck on band-aids? You know, those pills that don't seem to do the job, you know? And so, like I said, doing something naturally, and the fact that the reason we got into this fix is because of food, and food is the only thing that's going to fix it. But you have to do something. Plants. Like I said,
Exactly.
we came from the earth, and so we have to eat what's closer to the earth in order to
So
heal
so
the
true.
body.
And you talked about the stressors, and you know a lot of people don't realize your cortisol will not allow you to kind of rest. And I'm gonna, show
Yeah.
this. What I did when I was stressed out is I ate. I
Mm-hmm.
fed my
Yes.
emotions. How many of
Mm-hmm.
us do that? And then when your
Yes.
cortisol level is high, your glucose is high, your insulin is doing its job. It's saying,
Yes.
hey, let me go attack that and let me go help her out.
Mm-hmm.
And your cortisol said, well, girl, you ain't gonna get no sleep.
No.
And
Mm-mm.
then you're stressing. You brought up the fact about your stressing. Husbands are stressing, wives are stressing, children are stressing. I
Stops.
mean, we all are stressing because we live in a stressful world. But
Yes.
you made mention of your husband, and he had dealing with insulin resistance as well, right?
Yes, absolutely. Insulin resistance. And it's amazing because he was on the metformin. He came off of it. And matter of fact, being on this protocol, he's not taking it any longer. And his A1C is dropping or staying the same without pharmaceuticals, just doing the nutraceutical. Go figure, you know? And
Exactly.
so the natural way to heal the body, because God gave
Again,
us everything we need from plants.
exactly. So here we have a wonderful, beautiful couple here that had breast cancer. Hair came back. Then she became a holistic coach. Hair fell out. She gained weight. She was inflamed. Her husband was type 2 diabetic, and she's found these products to help. So we want to talk about some of the things that you can do, some of the tools that you can use to actually reverse insulin resistance that's naturally, that is actually found in the physician's desk reference, that is right
Mhm.
in the palm of the physician's hand, or if they have an electronic device that they can look at the
Mhm.
medicines and look at
Yes.
the side effects. But these products are the only nutraceutical that are actually in the physician's desk reference. But the
Yes.
first one is not. The first one God gave to us, and that's
Hmm.
intermittent fasting. That's
Yes.
fasting. That's time-based eating. And
Hmm.
once we do that, we'll allow our body to reset and just stop eating just for just a little bit. So just think, if
Yes.
you stop eating at 8 o'clock at night and allow your
Hmm.
cells to regenerate, and
Hmm.
to your body, your stomach actually says, oh, she's giving me a break. I didn't believe that could happen, because we were told to eat every 2 hours because that
Yes.
helps with your metabolism. Well,
Hmm.
no, that kind of causes metabolic dysfunction, and
Yes.
that's where you're fatigued, you're chronic, you're tired all the time, you need a nap. And those are
Hmm.
one of the issues that you use. So when you start, and that lowers actually your cortisol level when you think about some of the
Yes.
things like that that you're using. So that's one of the tools that you also use. So viewers, if you're watching and you know somebody that has been
Hmm.
dealing with some of the signs that I told you Miss Carolyn was dealing with in her husband, you have chronic fatigue, you have skin tags, you
Hmm.
have the balding, the inflammation, please
Hmm.
share this with somebody. If you're watching the replay, please ask questions. Miss Carolyn or
Yes.
myself will come back and answer those questions for you.
Hmm.
But we're going to talk about two products and one practice that equals measurable results. She already told you
Yes.
she was down 25 pounds within the first 90 days. And guess what? There's a 90-day money back
Hmm.
guarantee. How many
Yes.
pharmacies or doctor's office give you your money back when it
None
don't
that I
work?
know of.
None that I know of either. So when we talk about that, I want to talk about the first product. The first product I love so much. Let me tell you, and it actually helps me with the time-based eating. It helps me to with the weight control. It actually helped me with my liver cholesterol, producing
Mhm.
more lipids. And some people think cholesterol is a bad thing. We need cholesterol just to function. It improves my triglycerides. It actually
Mhm.
helps my HDL to keep me from having a cardiac event.
Mhm.
Improves your blood pressure. It acts, the theobromine in it acts as a natural vasodilator.
Mhm.
Will actually
Yes.
open up your blood vessels to actually lower your blood pressure, to let the blood
Yes.
flow through there without any pressure causing it to rise. If you
Mhm.
have asthma, COPD, the theobromine in that also helps relax the airways so you can breathe better. If you're dealing with sleep apnea, it
Mhm.
actually helps you sleep and
Yes.
where you can breathe better. It acts as a mood enhancer. So,
Mhm.
one of the things that my husband noticed was I was a Krabby Patty. I'm gonna go ahead and say it because a lot of other people notice it too. They just might not have been as vocal as my husband was. But it acts as a mood enhancer. So you think about a dark piece of
Mhm.
chocolate, how it kind of relaxes you, and your serotonin levels rise because of the mm, I
Mhm. To
got the
feel good.
freshness of new life,
Yes.
in me.
Yes.
It acts as that.
Yes.
The mental focus and the clarity, being able to complete a project. Just think about if you had ADHD or ADD and you're running
Mhm.
around, you're so unorganized, can't get anything complete.
Mhm.
That's what this product has in it. Also, the antioxidants and the properties that neutralize the free radicals that actually causes cells to die. People don't realize that
Mhm.
the free radicals causes cells to die. And I love the books that we use, that we learn from. Why do
Mhm.
we get sick?
Yep.
And if you think about the fasting like a girl, by Mindy Pelz and the things like that, that we read
Mhm.
upon and we learn about. But also, when I went to the dentist, I went to the dentist 6 times since I've been on this product. And my dentist said, I don't know what you're doing. He was trying to find something, but the
Oh.
tooth enamel, I mean, is amazing. And this is all a part of the tea that I use every day. So if you think about that tea that I sip
Mhm.
on, it actually help my stomach reset. It
Mhm.
has all the beautiful properties of the weight control, the decrease in the
Mhm.
inflammation, as she talked about, Miss Carolyn
Yes.
talked about earlier, of the inflammation, how she was so swollen, and how it's given her new life. So that's
Mhm.
one of the products that they'll talk about, and that's the unamate in the tea that we drink. So another product I'm gonna allow Miss Carolyn, if you would speak on, is the balance. That's the second part of
Yes.
this protocol.
Yes. Yes. Because the balance is fiber. And Mother Nature knew what she was doing when she wrapped our carbs in fiber, but man stripped the fiber out. So everything we eat turns right into sugar, and sugar is the culprit. Sugar is
Mm,
what allows our insulin levels to stay up way too high. And won't allow the insulin, of course, is the master hormone, and it's supposed to turn our food into energy to put it into the cells. But when we got too much insulin floating around, our cell get too fat and it won't take any more insulin. So that insulin, being that growth hormone, is what makes you have all that fluff. So we're gonna talk about the gut. The gut is our second brain. And over 90% of our serotonin is made in our gut. That's that feel good hormone. But because we eat so much salt and sugar, and so those bad bacteria, so our we have good and bad bacteria in our gut, but they're on equal playing grounds. They're supposed to be anyway, but because all the salt and sugar, so the bad bacteria outgrows the good bacteria, and that's not good because now our serotonin levels are low, causing us to be not as happy anymore, can cause some depression, all kind of issues. And so that's the beauty of our balance, our fiber. It coats your stomach. So we normally eat it, take it right before your meal. You shake it up and you drink it right before your meal, and it actually coats your stomach. And by coating your stomach, it makes you feel full longer. It helps you burn the fat. It will lower those the bad cholesterol, LDL. It will raise the high cholesterol, the HDL, which is your good cholesterol, lower your triglycerides, and it won't let you have the spikes in your blood sugar. I mean, that is just so amazing by itself. And taking this fiber, usually without the fiber, you eat and you go get a second plate. You just don't feel like you ate and anything. But with the fiber, it makes you feel full. So guess what? You're satisfied when you eat that plate of food. And so that's the important thing about our fiber. It helps you get those parasites back on the equal playing ground, get them balanced back out so that your serotonin can be produced. And like I said, that brain, that gut is our second brain. So it is really, really amazing what just something that simple, putting that fiber back into our gut says a lot.
That is amazing, Miss Carolyn. Thank you for uh, diving in and taking over that, because people don't understand that whole foods that are natural, that made from the ground that God gave us,
Mm-hmm.
will help us tremendously. We're not stuck without hope. God has placed hope all around us.
Mm-hmm.
He's placed
Yes.
help all around us.
Mm-hmm.
And that's what we're trying to do. We're trying to help 1%.
Yes.
Just go back and think, when you were young, your grandmother always said, "Don't come in here snacking in my kitchen." She always said that, and that reminds me of, wow, God placed it right here just for us. So,
Mm-hmm.
viewers, we thank you guys for coming in and listening to me and Miss Carolyn. If you have anybody that's dealing with inflammation, hair loss,
Mm-hmm.
a recovering breast cancer survivor for 16
Mm-hmm.
years, 42 years in the medical field as an RN, and now a holistic coach, because she's seen the front side and the
Yes.
back side. When you've
Yeah.
dealt with hospice, you've
Mm.
seen a lot. So
Yes.
knowing what you know now, Miss Carolyn, what can you add as a final piece of this segment here to help encourage somebody?
So what I want to say, if you're on the fence, it's a 90-day money back guarantee. So only you don't have anything to lose, but look how much you will gain if it works for you. Because most people are sick and tired or being sick and tired. And the thing is, a lot of people are praying and asking God for an answer. Suppose this is your answer today. Maybe you just stumbled across this here video and you're like, oh, let me listen, because I've heard people say that over and over again. But God gives us a way out of everything, and we know that all you got to do is trust Him and believe that He's going to show up. He's never too early, He's never too late, but He's always on time. So He's not going to leave you out there hanging. He didn't leave me out there hanging. He didn't leave Delana out there hanging. So guess what? He has no respect of person. So what He did for us, He will surely do it for you. So if you trusting and believing for a breakthrough, I'm tired of doing the same thing over and over again to get the same results, as we call insanity. Try something different. Try this protocol, and we will we can guarantee you with the back from by the company that you will get some results. So thank you for having me on, and I'm just so excited about being able to share with so many people who are stuck in this body that they don't even recognize anymore.
And that's
Thank you.
that's what it is. We were stuck, and now to go back to living, I mean, I feel like I've had 20 years of new health brought back into my life. Miss
Yes.
Carolyn, you are amazing. I am so grateful to have you as a friend from North Carolina that I would have never met. This brought us together. God brought us
Yes.
together. So we're here. We're telling people about this. I thank you for your time. I thank you for the opportunity to get to hear your story. And I thank you for helping others. So
Yeah.
I tell you what, if you know somebody that needs this and you're one of Miss Carolyn's friends, please reach out to her. If you're one of my friends, please reach out to me. We'll help, we'll coach you, we'll help you along the way. You will
Yes.
not walk this journey alone. Thank you, Miss Carolyn. You have a
Thank you.
beautiful, beautiful,
Appreciate
blessed
you.
day.
All right. You too. Bye bye.
Bye bye.